has to have, I always think, it has to have even viruses there has to be some way of what I would say, something that decides what happens next.
Yes.
Maybe not a mind in the way we have or
Mm.
we think of a mind, but maybe evolution itself
Yep.
decides.
Programmed into the genes,
Genes,
genetics.
yes.
Exactly.
Yeah.
Oh, it's
Sorry,
almost
now
time.
I need to. Okay. Sorry, all of a sudden this was playing on two different systems. So
Oh.
yes. Right. We are almost on time. Hello, Dr. Vivek. I can see you are here. You can put on your camera. We are having a informal anniversary meeting. So
Evening, ma'am.
yes. Hello.
Hello, Dr. Vivek. I met him recently at
Good
Okay.
evening,
Lucknow.
sir. Good evening, sir.
Good evening, good evening. How are you?
I'm good, sir. Thank you.
Right. So of course, our general tendency of everybody joining late. So everyone is going to join late. Uh, we should tell Professor Nirenberg, this is typical for us. In India, we have, the short form for our time is IST, Indian Standard Time. But the
Yes.
other way is Indian Stretchable Time. So
All
everything
right.
can
I like
stretch
that.
a little bit. We are used to it.
I like that. Yes.
Yeah, it is.
I
It's
found
life
it.
here.
Yeah. I found it unusual in that you've got not in the time difference, not an exact hour, but an hour and a half. It's got a
Yes.
half hour.
Half hour, yes. Yes, we are on the half,
Yeah.
on the 30-minute difference. Yes.
Yes. Yeah. So we've got in Australia, we've got 3 time zones, but the middle one again is half an hour from the eastern one, only half
Okay.
an hour. But of course, we've now got vertical time, north-south time zones as well now, because some states are on daylight save or summertime and others aren't.
Wow. Okay. That's
So
very
we've got time
confusing.
zones going east-west and we got time zones going north-south.
Yes, but then I guess Australia is a very big
Yes.
expanse of land. Yes.
Mhm. Yeah.
So
But so is India. You wouldn't be, India would be same
yes.
size, bigger.
No, I think India is about maybe a little less than
Yep.
2/3 of Australia.
Oh,
India is big,
yep.
but
Mhm.
yeah, not as big as Australia.
All right. I didn't know that.
Yeah. And India is narrower east-west. We have a
Yes.
higher,
Mhm.
more north-south
Yep.
dimension than east-west dimension.
Yes.
Australia, I think, is almost squarish.
Yes, it is.
Yes.
Yes.
Yeah, it's sort of a rectangle, so it's
Yep.
wide actually in both dimensions.
Yes.
Yes.
So trying to get anywhere, hours pass and you're still in the same country.
Yes. And you want to change countries fast, you have to go to Europe. You
Oh
just
yeah.
have breakfast here and you are
Yeah.
having
Yeah.
midday tea at,
Yeah.
you're having
Yep.
brunch in another country.
Yep. But
Yes.
that's one of the wonderful things about Europe.
Yes. Yes.
Even in a restaurant, the table, both the chairs will be lying one in one country, the other one in another country.
Yeah.
There are
Yes.
some boundaries are like that only.
Yes. True. And most of the European boundaries are rather friendly boundaries, so they don't mind.
Yes.
Oh
Yes.
yes, absolutely.
That's why
So
you get Schengen visa, no ma'am? Because
Yes.
you get the visa for all of the Europe.
All of it
it-
together. That's true. Yes.
and for most countries, you don't have to worry about changing currency and having several currencies you're carrying anymore. In
That's
the old
true.
days, you used to have to do that.
Yeah, actually, yes. And some of them were like literally what I would say suitcase full of money had to be carried.
Yes. The Italians, especially
The
Italian
Italians.
lira.
Yes, yes, seriously. So now it's better.
Oh,
Yeah.
yes,
Actually, when the world unites, it's always better.
of course.
Sadly, at this moment, we have more wars going on than we have ever had, I think, for a long time,
It's
which is
true.
very sad.
But I don't think there's really been much in the whole of history, there hasn't been that much time when there's been peace
That is
everywhere,
also true.
I think.
Yeah, that's also true.
That's why we're lucky where we live, I think.
Yes. Finally, it is one of the greatest things that decides human fate is literally your location.
Oh, yes, absolutely.
Yeah,
And it's just good luck that you were born in a particular place.
very true. So we are 4 minutes past our starting time,
Mhm.
and we have a couple of people on YouTube, surprisingly, but there are people on YouTube. Hello,
All
thank
right.
you for joining us on YouTube too. And we are here at the meeting. So today we are having I would say an informal gathering. And the idea is basically we are celebrating our 4th year anniversary of Oral Pathology 360. And we really started as just an idea, but we have grown. And we also started as just oral pathology. Then we went on to the diagnostic sciences. And currently we have also expanded to include management. So we have gone a long way and we have managed to do it together, and that's really what matters. It's always been about education, about growing, about collaboration, and naturally at the end of it all about our patients, because that's finally what we are existing for, not ourselves but for our patients. Everything we do is for our patients. So it's I just thought for this one occasion we should have a informal get together, chat. Maybe you have any questions, ask us your questions. I got with me Dr. Bhuvan Nagpal, who is the president of POPMA, which is a very, I would say, innovative and original association that is of the practicing oral pathologists. So this is for the dedicated practice of oral pathology and oral microbiology. Not that there is anything wrong with being an academician or being a researcher, but well, those are different phases or different faces of oral pathology. Here, this is for the practice. We are also today I'm very happy to say we also have a pathologist with us. Dr. Alexander Nirenberg is with us from Australia. And this is what we have always had the vision is to, uh, as far as oral pathology goes, we are at the junction between medicine and dentistry. And that junction is at pathology. So we have always had this vision that we will equally work with pathology. And pathology is, most of us have been taught by pathologists, and it is, we are very much a part of pathology, and pathology is also very associated. So it's great to have a pathologist with us, and that too all the way from Australia. So very nice. And yeah, we have more people on YouTube, right? So yes, good evening, Dr. Vivek. And we have Dr. Anupama with us. Good evening. So with this, let's just start. If you have any questions, actually a year ago, let me start with Dr. Bhuvan. A year ago, he was on the channel. We introduced POPMA, and from there the association started. And what today we found very interesting coincidence that the name of POPMA was registered exactly on this day last year. So We share one anniversary, anyways. And now I'm going to let him just tell us a little in short about what POPMA has done, because there's a lot of advocacy involved there. And we know advocacy is important both to us in oral pathology and also to pathology. So let us just hear from him. Hi, Bhuvan. Great to have you here.
Hi, ma'am. Good evening, one and all. My warm greetings to everyone. And once again, thank you so much, ma'am, for giving me the opportunity to come on your channel and share my views. Um, the last one, when I connected with you for POPMA, for the unveiling of POPMA, that was 21st of November 2023. And by then, we have come a long way. And POPMA is promoting the practice of oral pathology, and many works have been done. So I'll tell all that in a brief form, that we have created one Academy of Oral Pathology and Microbiology and Lab Medicine, that is AOPLM, under the banner of POPMA, and which offers observership and fellowship courses. These are basically the skill-based courses. So anyone who is interested to hone up their skills, and they want to be uh, to to become more competent pertaining to the other sides of other aspects of oral pathology, like hematology, microbiology, biochemistry, and serology. So those parts will be taken care of under that. And we have, as of now, members from 17 different states. So it's a pan-India level association, and we have a multidisciplinary board under which we have members from 19 different specialties, including we have a dermatologist also with us, as sir is there, Dr. Alexander is there. Then I just wanted to inform that we have created one research grant, that is POPMA research grant scheme for MDS oral pathology students, and the under which 15,000 rupees grant will be provided by POPMA to the PG students of oral pathology, and they have to submit with a standard protocol which is available on our website also, that is popma.in. Then we have also created POPMA Gold Medal and the Award of Excellence in Oral Pathology, under which a certificate of appreciation and 5,000 rupees cash prize and a medal will be provided to the deserving candidate. Then I have myself created before POPMA that HOPE, HOPE, that is Helpline of Oral Pathology Inquiries. So now it has come under the domain of POPMA also, and the number for which is 7027038190, which is available Monday to Saturday, 9 a.m. till 7 p.m. And under that, any queries pertaining to oral pathology, be it the practice, be it the subject, be it establishing new lab, so everything will be entertained and the direct call will come to me only. Then we have we have advisors in POPMA. Already I have discussed in my previous video about the governing body and the general body. We have a IT cell. We have different state representatives of POPMA. They are from 1 or 2 state representatives from each state. So as I already told, that we have members from 17 different states of India. So we have almost some 25 or 26 state representatives, which take care of the problems of oral pathologists of that particular state. And they have other rights also, like writing or making representation to the government bodies. The whole and sole aim of the association is to promote the specialty practice, and under which we are already authorized, but there is no clear-cut guidelines as of from any statutory government body for making oral pathologists as signatory. So POPMA has already written to the Honorable Prime Minister and the Health Minister of India for considering our qualification, that is MDS Oral Pathology and Microbiology, for employable job opportunities in cancer centers and diagnostic centers in all over India. We have also started a study club under which we have a session of practice oriented oral pathology session, and that happens every 2 months. So we have 4 sessions, and thanks to you, ma'am, you always help in organizing that. Then the last is we have started with a magazine. This year will be a yearly magazine that is by the name of The Oral Pathologist. And the name has already been trademarked. We have applied for ISSN number. So that will be a informative magazine, and will provide insights into the newer developments of craniofacial pathology and diagnostics and therapeutics pertaining to the oral medicine and oral pathology. And we will highlight the achievements of our members and what POPMA is doing for the fraternity. That all things will be highlighted in that. I think these are the major ones. And rest, one more thing I wanted to tell, that the student members who apply for the life membership of POPMA, they have access to the free observership of 15 days. So that will also be there. And POPMA has already done discount agreements with approximately 12 different companies pertaining to diagnostics and the quality management systems and many other different equipment vendors. So they will provide special discounts to the members of POPMA. So that has already been taken care of. Ma'am, your mic is muted.
Yeah, I realize. So, interesting journey, and it has been quite a busy year, I know, because I know what work you're putting in, and I get to hear directly from you, and I see the activities. It's been a lot, and I'm really happy with the way things are going and things are growing there. Now, if anyone here, basically, you can all put on your cameras and we are just having a chat. Uh, you don't need to keep your camera off, so you can ask any question you have. Uh, in the meanwhile, there is a question on YouTube, so I will just tell you that, and I think we know the answer, but we are going to say it. So there is a question as to why is that MDS in oral medicine and oral pathology are considered non-clinical. Now we know the answer. There are no non-clinical disciplines in
They
dentistry.
are not at all. No branch is. See, some people say it as a paraclinical in terms of the medicine, and they say for especially for our branch that they are non-clinical branches. But how they are non-clinical? I do agree that sometimes we do not come across with the patient, but the sample or the specimen which comes to us is also a living tissue. So based on that, you are going to make a diagnosis which is gonna impact the patient's treatment outcome. So there is no entity known as non-clinical. It is just your mind which says that it's non-clinical. And maybe the reason that for so long time there were no practicing oral pathologists, only institutional practice was there. So maybe where PGs were there, so there the practice was quite into the picture. But where postgraduate trainees are not there in the departments, so maybe it is more of a teaching or academics. So that is the thing.
True. Uh, because basically we have been, I mean, oral pathology has been essentially missing from the practice of dentistry. If you talk to any dentist and if there is any problem, they can get you anyone from any of the other branches of dentistry, but almost very few can actually get you an oral pathologist to give you a consultation, because we have been missing. We have not been out there giving the support that we need to give to dentists for completing the entire the cycle of treatment, or the entire range of treatment. Finally, if you look at it, pathologists are out there.
Yes.
There are pathologists in practice. I mean, any you cannot even imagine medical practice without pathology.
Yes, yes,
And
that's
it should have been the
totally
same way
true.
with us too.
That's totally true, ma'am. In one of my philosophical presentations, I have said that what will happen if all the information which we have as of now for pathology goes off suddenly? It's a hypothetical question, but just
Yes.
imagine that what all information we have, or for that matter, if any pathology is not there, what they're going to do. Say, for example, dental caries or periodontitis or any skin lesion or any ulcer or any carcinoma. If those things are not occurring, what they're going to do with the patient?
Yes.
So understanding normal is there, pathology is there, and then only you are going to do the treatment. So it is just about the mindset which they say. So uh, I can only say that where a needle can do some work, the sword cannot do that.
Yes.
So it's always like to respect everything. Like we cannot say that which organ is more important. Somebody will say that heart is more important. So our kidneys or liver is not that important or what. So that's my take on that.
Yes. That's very true, because really, frankly, I mean, there are these very interesting videos created by Royal College of Pathologists. And it's like, if pathology was not there, that's exactly the same thing, hypothetical. So they have this patient on a bed, and everybody comes and keeps looking at the patient up, down, this side, that side. But without pathology, what are you going to do?
Yes, yes, that's
They
true.
just, it's like, okay, let's tickle the patient and see if we can find something, like it's like it's a imaginary situation, but it truly is real. It is not possible. And that's not to say the other branches are not necessary. They are also essential, but it's to say that basically pathology is about as essential as the treatment arm of medicine
Yes, yes,
or
yes,
dentistry.
that is true.
True. So, do we have, okay, everyone who is here, anyone has any questions from me or from Dr. Nagpal or from anyone else? You can already see everyone who's in the audience. We are just having a chat. All of you can put on your cameras, and if you have a question, you can just say it out. Even if you just have a comment or a thought, you can say it out. Hi, Dr. Arushi.
Congratulations, ma'am, on your 4th anniversary of Oral Pathology 360.
Hi, ma'am.
Thank you so much.
And
Thank you.
you're
It
doing
is
a good job.
everyone being there that has made it possible for us to reach here.
No, ma'am. You really, really, the upliftment process. So you are the air below our wings.
Thank you so much. Yesterday we had that open mic, and it was a students one.
Yes.
You all will be happy to know we had
Oh,
39 students who took part. A good number were undergraduate. They were not even graduate. And over 2,000 people watched and voted.
That's really good.
that was amazing. That was really
And you know
amazing.
what is the good part about that, ma'am? At least because you are working at the root cause. Because the UG students, they have to be empowered and they have to be like informed first, because they are the ones who are going to take the subject forward by taking the post graduation or doctorate in that. So what happens in Indian scenario, the UG students are not exposed to the work which we are doing actually. the practice part. They just think that they have to read one textbook, be it Neville or Schaefer's, and then pass the exam and go with that. So nobody thinks about that, what is happening at the tissue level. And it's my request to all the academicians and to all the viewers, please encourage the students who are at the undergrad level to see the subject from a broader perspective.
Very difficult.
Yes. Very difficult, but we have to work at it. We really
Yeah.
have to work at it.
Mastering dentistry and all that part 1, part 2, 3, and the subject left into that part. Don't think people are reading Neville or even Schaefer's. So
Yes, I know they read those horrible guides. Oh, I hated those guides.
so
When I was teaching, I have confiscated more guides than I have ever done anything. Every day I used to have this collection of books because students were not
I don't
allowed
know
to
why
read guides.
shortcuts are being taken.
I think
It's
the
a
teacher,
it's a saying,
Yeah.
no, shortcut will cut you short.
Yes. True, very true. And we used to have, I mean, this, I don't know if guides are still around, but in 2010 or so, they became a big deal. And you had, instead of textbooks, you would just have this thing, this small little collection. They were more like notes, which was like not really a whole topic. It was a question and its answer.
that's for
Yes.
master.
Yeah. Oh God, those were horrible. And most of them were drastic. Yes. But you know what? I always found, and we have some other seniors with us too. I don't know what is their experience, but I found that when I was in academics and I used to take exams, one of the things I never really expected a dental student to know oral pathology the way we did. It's not realistic. But I did expect at least that they should be able to tell me at what point in their everyday practice will they require an oral pathologist. I used to actually ask, okay, at what point? I mean, what sort of a case or which day of your work do you imagine that you will need an oral pathologist? And I used to be so shocked that they could almost never answer me. They would say something, if I need to, treat so and so lesion. I said, treat. So you don't need an oral surgeon, you need us. Then they'd say, no, 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 that would be for oral surgery. So, they were never very clear as to what we oral pathologists do. And if they don't know what we do, how will the average
Yes.
dentist ever refer to us? Is my understanding. See, medical practitioners know when to send a case to a pathologist.
Yes.
And that's what happens. They send cases. But dentists don't really know when to send us cases.
This is the lacune, ma'am, actually in our teaching curriculum.
Yeah,
So
they have.
students, undergrad students should be like exposed to the world of diagnostics from undergrad level. At least they should be shown that how that histopathology processing is done, and this is the work we do. How you have to take the diagnostic biopsies, whether incisional, excisional. Okay, they read that. Anyways, if they are not doing, also they are calling some consultant to do that. But then how you have to send it, which
Yes.
fixative you have to use. So you see now that's what is happening. People are not sending samples in formalin. Today I got a call from 200 kilometers. I got call from Delhi, and they were not having formalin. I straight away refused. I never take any samples which is not preserved in 10% formalin. So saline and all those
Yes.
things will definitely alter the tissue architecture and will hamper my diagnosis. So why we have to go with that?
Yes. I mean, the very simple thing I always think is it's a simple rule that is taught in general practice at least, is that any tissue that comes out of the body should go for pathological
Yes,
analysis.
yes, this
Why
is
don't
what,
we take every bit of tissue that comes out of a socket?
Curettage should be done. Every curettage biopsy has to be done,
Yes.
which
yes,
is
yes.
And it's
This
not
is
even done in colleges where oral pathology departments are there.
no.
So if students were doing it in a college, they would get trained that this needs to be done. Because finally, where is the bigger part of dentistry is in the treatment. That's what they do every day. They treat cases, they do extractions, they do root canals. So if they begin to learn, they see it happening, then they will do it. I mean, I'm sure in medicine, every time they take a piece of tissue out of the body, they don't just throw it in the bin. We actually throw teeth and any attached granuloma into the bin.
no, it should not be done, ma'am. Even the AAOMP guidelines, they say that any tissue which is being taken out from the oral cavity has to be submitted for histopathology examination.
Exactly. But we need to really begin to, drill this in to the students. And uh, the fact is, we actually have a very good amount of time with students because we start teaching them for some absurd reason, which I never agreed with. But anyway, we teach them histology and then we teach them pathology. So we at least have them for 2 years. Hello, Dr. Vandana. Hi.
Oh, how are
Hello.
you?
I'm
Hi, ma'am.
good.
Congratulations to you first
Thank you.
for 4 years, and actually commendable that so many people attended the open mic. I couldn't
Thank you.
yesterday because of weather conditions here, too much of water flooding here in Vadodara, all rains
Yes.
and all. So connectivity and all was a problem. Electricity connectivity was a problem.
I heard yesterday you all
so
were having
I
quite a lot
couldn't-
of rain.
Yes. I agree totally with what you're discussing and you're telling.
Hmm.
It just we need to, I mean, this was actually commendable because in the sense, at least we ignite the undergraduate minds towards oral pathology. The first thing is we need to ignite their minds towards oral pathology. Because what they feel oral pathology is just blue and pink. No, mug up the slides and pass
Yeah.
the
Yes,
oral
yes.
pathology. Like guides, what you said. Yeah, we used to confiscate a lot of them. And I've told if I see anything except for Sheffer or Neville, I'm going to take it. So that's what we do.
Yes.
But then how to stop them is,
You can't
but
stop.
we need to ignite their minds towards oral pathology. That's what is important, before they can, they really get interested. So that is what we give them training in histopathology. Interns, we've started giving them training in cadavers. We ask them to do biopsy from cadavers, and they
That's
do the
nice.
processing by themselves. But I don't know how far we are going to succeed, but at least we've started.
of course.
They take biopsy from the cadavers. They do the entire processing and then staining. At least the normal ones. So they at least know the normal buccal mucosa. Okay, I have done it myself.
True.
So let's see how far we go with it.
And I have one suggestion which I'm thinking to write to our council, that we don't have any posting for oral pathology in third year onwards. Like we should have a 1 month posting, a rotatory posting, like we have for all the clinical branches or for other branches. So that should be there because the subject is in the third year. They I think probably from second year onwards they start teaching now, or how is it? It used to be my
Second year.
time. It's like that only. So
Second year.
third year we should have a 1 month posting, so they should be made aware. And then in internship, instead of 15 days, it should be made 1 month again. Then only the students will get sensitized. And we have to change the examination pattern. That still spot examination is there, 10 slides are there, they are focused and they are going round and round. Ma'am, even in NEET examination, that histopath picture is being displayed and they are asked to make the diagnosis. So by such reforms, I think change will come, and it's high time that change should come.
High time. High time. That's the main thing. It's high time because actually oral pathology is the only dental subject where there is no posting.
Yes, that
A
is
dental
that is the
student does
major
not have an
thing,
oral
ma'am.
pathology posting. Yep.
And then
There's much to
even
do.
you see the PG curriculum, because I was so passionate for the subject. I used to read the curriculum from my internship onwards while I was preparing for PG and other things. So you see the examination pattern, ma'am. Again, that histopathology 10 slides will the examiner, external examiner will get. And then we have the HB estimation. Now, who in practical world, who uses that Sally's method? So they should make adapt to the machine part, because machines are doing the work already. The AI is there in those machines, but how to read those, how to interpret those results, that is not being taught. And then so many things which are being done in the colleges, like serology part and other aspects, so those are never talked about. And how to apply those knowledge is not there. And what is being instilled in the minds of the students is that oral pathology is all about histopathology, which is not so. You have seen that many diseases which we read today, we may have to take the help of genetic testing, molecular testing. Even if we see a case of burning sensation or some kind of atrophic changes, we need to do a CBC, or so many other things are there, be it any thyroid lesion, or so those parts are not as a part of curriculum, so should be made in that way. Because you see, if we see our things, that implant is being done by the even the BDS graduates are doing that, so they are taking that training outside, or maybe in the yes, in the PGs also, in the post graduation curriculum. So such kind of reform is the need of our, what I believe.
Yes. I don't
I
think even
agree
the
with
colleges actually ever do a Sally's method anymore. Everybody has an auto analyzer. Only for the exam, I think they take out those tubes and do the Sally's method. I'm sorry, Professor Nirenberg, you were going to say something.
Oh, I was just going to say I agree with everything, but I was just wondering, would it help if the students had to do like a case book of so many, I don't know, 5 long cases which had to include oral pathology in the case, so clinical, the radiological and the pathology, and you had to have one of certain diagnoses. Because I know in dermatopathology diploma, certainly they have to do a case book, at least in Australia I'm talking about, yes.
Right. True. Well, we have cases that we have to do in our postgraduate training for oral pathology, but undergraduate, I don't think so. Currently, I think Dr. Arushi, you can tell us, do the students have to do anything like that?
No, ma'am. Undergraduates, they don't do. And postgraduates, we start with first year seeing the general slides. Then we start reporting from the second year onwards. We do have in certain colleges, I've seen clubs, study clubs are there where the cases are discussed like now on a fortnightly basis, and the oral pathologist is called, then there's oral surgeon and the departments, various departments, like they come together, and there we put up a case, but everybody presents their part of the how it was treated, and we take up what was the role of the oral pathologist. So it's that intermingling. So even the oral pathologist postgraduate is called. Otherwise, we generally left in our
Yes.
department. But interdepartmental case report, is definitely a feature in few colleges, but all that in the postgraduate level. The sad part is with, as the questions, first somebody said that it is a non-clinical branch. That tape of a non-clinical branch should be removed. What it is about. So that needs to be done. And my suggestion, can you hear?
Yes.
Ma'am, my suggestion would be at least, ma'am, just the way the general pathologist you were telling about the videos, the people who are actually practicing, we have our labs. We can come up with a small of video that we are oral pathologists and this is the way we are dealing with our labs. So when something comes forward, like no, we can make a small video of our labs at our place. We can take a few interviews of our referring dentist of different branches and how oral pathologist is helping them. Those people who are doing it. So like Bhuvan has it, I'm there, somebody in Kerala, or those who are in the private practice, we can come up with these small videos and one you can post it in your channel that this
Yes.
is pathology. So I think now it's time that we come to know that we are super specialization of general pathology, and this is how we are helping. So a little bites from the referring dentist and how our lab looks, how we are doing. A small thing video would definitely, I think, interest people that yes, after oral pathology, we can do this, which they have not been doing, and how we are helping few bits from if from the patients we can get. Like definitely when I give the reports and they come back after treatment, they are very thankful that you at least hope people from general dentists send me these cases where they're just running around what to do with it. They cannot understand. So such snippets, some videos like that of labs taken care by oral pathologist right now. And I think this Bhuvan can point out those people, and this should be highlighted. Like now, this is oral pathology, just not in your departments. So I think that would just bring about interest. Oh, oral pathologists do that. Apart from
Very
just
true.
finishing graduation, and you're back into your clinics and filling cavities and doing root canals, and nothing we do. But we are people who are doing and how it is, and then they can ask and like no. So I think this would be a good idea that we advertise ourselves. So those people who have taken a step ahead should do that, because otherwise it is, I do not know very seriously, lots of research is going on, yes, but how much practicality is there when we diagnose that? Those research, those big markers at our level where we haven't down, it's more of that H&E and the basic diagnostic and the
Yes.
labs. So that has to be really the crux of, like, no, you have to be like,
Yeah.
no, this is what we are going to do. Yes, we can take help from other things. We do that. So let's advertise ourselves. And right now, ma'am, I feel your channel has a very big viewership. So such things can be done to highlight what we are doing. So that would just at least remove that small curtain that it is not just a non-clinical branch. A
Yes.
branch where they are right now doing, especially in the north, they are doing two PGs just for an MDS. On their board, it is MDS, nothing to do with oral pathology.
They don't
Patients,
even write the
no,
specialty.
they don't write the name of the specialty, but patients are aware that there's something after BDS, and these people are specialized. But poor part is that they do not know what kind of MDS. So I think it's time that we do something like that so that it
Yes.
brings.
No, it's a good idea. Actually, I had been planning to do this even with the colleges themselves, with the departments, that each department can showcase, because departments have also so many different abilities. And, to showcase what the department is doing, what the department owns, and what are the abilities. I have still not got any department coming forward and doing it. A lot of people have said yes, but no one has actually done it. But I'm very open to having something like this from the individual clinics and the individual setups. Absolutely, it's a good idea. Yeah.
It's already my video, the video of my lab and pictures are available on the internet. for my center. For both the centers, I have one dedicated center for oral pathology, that is COPMD, that is Center for Oral Pathology and Maxillofacial Diagnostics. And the other one is Tohana Mangalam Diagnostics, where I do all the aspects of even general pathology also. So I was just, I have shared, I think a day back, that renal path labs, when people can have only histopathology pertaining to renal pathology, then why can't oral pathology as a branch, which is acknowledged by the Royal College of Pathologists, and everywhere it is being recognized as a known branch of pathology and dentistry. So why can't, as oral pathologists, we should promote that thing? And people have so many doubts pertaining to establishing even the histopathology lab and or the general pathology lab. So I have got into so much of economics and other aspects of it. So any help pertaining to that is more than is welcome from everybody.
Yes. So, okay, we have one question here from Dr. Anupama. Anupama, you could also put on your camera and ask the question, but anyway. So, could we shed some light on what oral pathologists bring to the table in supplementation to what the general pathologists are already providing? This might highlight the niche or role of an oral pathologist over a general pathologist. So, in what way are we? What is the different thing we bring to the table? Ma'am,
Dr. Roshi wants to answer, or shall I? Ma'am should first answer.
Let us just see. I noticed Dr. Nirenberg wanted to say something. Let's hear from a general pathologist.
Okay. Well, I'm a dermatopathologist, so I know a bit more. I mean, it's a bit like in medicine, a general practitioner versus a specialist thyroid surgeon, someone like this, is you've got a general knowledge, but you don't have the depth of knowledge. So I think what a dedicated pathologist, like an oral pathologist, can bring is a depth of knowledge and the nuances. So a special or subspecialized pathologist will know the variants, especially the rare variants, and be able to tease out a differential diagnosis list and know exactly the subtleties. Whereas a general pathologist, I think, can't have the depth of or most don't have the depth of information because they've got such a broad knowledge to keep up with, whereas you're keeping up a very narrow field in depth. And I think that's the most important thing that we can bring. And it doesn't matter whether you're a thyroid pathologist, a liver pathologist, it's exactly the same answer, I think.
True. Very true. I just wanted, because we all keep saying it, but we are all oral pathologists and we are obviously biased. So I thought we will have a neutral person talking about it. But let's hear from the others also. Yes, Arushi, what did you want to say?
Ma'am, I had an opportunity to go to visit Brisbane, and I went to this general hospital lab there. My brother-in-law is there as a general pathologist, and there I met a senior pathologist who was specializing into oral lesions. He was sitting with the slides of oral, and then when I was introduced that she is an oral pathologist, he was so surprised. He said, "What did you do? Where did you do your pathology? Where did you?" I said, "No, ours is after dentistry." So that is a specific, very surprising element, I think, for people abroad, that we are basically dentists. So we have concentrated ourselves into oral cavity lesion only, and then we are specializing this. The oral pathologists, we are not general pathologists who are super specialized, but we are basically dentists who are oral pathologists. And apart from that, what I have felt different from the general pathologists is I somehow feel the oral lesions, especially the bone lesion disorders, the bone of maxilla and the mandible, the lesions present in a different pattern as compared to like fibrosysplasia. If you see in the jaws as compared to near long bones, it's slightly different. Ossifying fibroma, which it's slightly different. So that small minute nuisances which you call, which are there in the oral cavity bones, which are not a feature of long bones, though the lesion is the same, fibrous dysplasia here and there. So that is the catch. And many a time the diagnosis is then gone. It's like, now how do we go about it? So that, like the case which I had presented, like rossing, everything, it is different. For that case which I had presented, ma'am, in my presentation, I really had a fight between the general hospital and myself, that it was an ossifying fibroma. So I think there are some differences in the lesion presentation, which we would say are more well versed, because we have not been seeing lesions in the other area. So that is a difference which I feel as an oral pathologist. Cysts, general pathologist, here I can tell you about my city, it's a cyst. A diagnosis is a cyst there. But what cyst? No. It's like that. They know it is a cyst, but what cyst? They come up, dentiture cyst, this thing, big like general headings they do not have a specific diagnosis. So that is the little difference what we have. A glandular cyst or a maxillary antrum cyst, or the small variations which are there in the oral cavity are, I think, because they have the whole body to do. So it's not their fault. Not their fault. They are definitely, they have more amount of information than what we have. But since we are stuck for 3 years with this, I think, and the bone is slightly different. That I don't know if people have done more work, but the lesions present in a slightly different pathological fashion as compared in the long bones. The oral lesions are also slightly different. So I think many times we just have lesions in the mouth and not in the body. So that might be the only sign which is there. So the patient gets confused as to what has happened. Is it just an ulcer or vesicle? So I think that is the little cutting edge which oral pathologists might have as compared, or what might bring to the table as compared to what a general pathologist can.
True. Yes, Dr. Bhuvan.
Yes, ma'am. I totally agree with Dr. Nirenberg and Dr. Arushi. Just want to add that the kind of clinico-pathological correlation which oral pathologist does as a clinician, as a dentist, is not so with the general pathologist, which I have felt. Like you see, any periapical lesion which is of a granuloma type, when you see under the slide, it will look as an inflammatory granulation tissue. But we know the tooth number. When the dentist has sent that specimen to us, we know that it is from particular tooth number. And when we relate clinically and see the radiological aspects, so we get to know that it is a periapical granuloma. But only histopathologically, when we see, our diagnosis will be different. And same is the case with dentigerous or radicular cyst. So this is one example, as Dr. Arushi madam has rightly said for that. And yes, that is true that Dr. Nirenberg has emphasized that we totally specialize into the niche area of oral and maxillofacial pathology with a good aspect of general pathology as well. So what a chapter is there in their textbooks, we have a complete textbook on that. Like we have salivary gland disorders, we have complete textbook. We have odontogenics. So the kind of information we have on particular lesions is more vast than a general pathologist. And what I myself incorporate into my reports is that I always emphasize into the clinical details and history. Then I write the presentation, how it is, then the radiological aspect. Then I emphasize that corroborating with the clinical, radiological, and histopathological features, a diagnosis of such and such is rendered. And then what are my comments on that and what is advisable for the clinician. So that is where I feel, because you see, when a uterus comes to a general pathologist, they have not examined it clinically, but we can somehow, if some clinical picture is there, so that oral cavity is quite accessible, we can see how the borders are there, how the lesion is. So I believe that that is one difference which oral pathologist has from general pathologist.
Very true. I think essentially there are just two things. One is the fact that no doubt we are almost like a super specialization. The second thing is that we understand the development where the oral and maxillofacial structures, whether right from the mucosa to the bone, essentially they are very different
Yes.
and rather unique. Another thing is that because we understand the kind of treatments that are done, by virtue
Yes.
of being a dentist, we know how the tissue is handled, how the treatment is happening. So we can also understand sometimes when there is a consequence of treatment, that could be the other part. And of course, by virtue of the fact that this is all we do, this
Yes.
is all we do. Now, you think in the last 2 years, how much the WHO has changed the classifications? They keep removing and adding and removing and adding like it's the regular pastime. So, how would a general pathologist who has to think of, and we are only aware of this much, and in that much, the WHO has changed so much. If you think of the whole body, how much they must have done, I don't even want to imagine. It's impossible for anyone to stay that much up to date with everything in depth. So yes, definitely it makes a difference. And one thing is, I think with in England and in Australia, perhaps oral pathology is a branch of pathology. People have to become a pathologist and then do head and neck pathology or oral pathology. For us in India and in the US, we are dentists first. Oral pathology becomes a branch of dentistry, which is different. But of course, it has again in the US, although they are oral pathologists, they have to actually study the whole human pathology.
Yes. Yes. Yes.
Their syllabus is not limited to oral and maxillofacial like ours is limited to oral and maxillofacial. So there are differences around the world, but definitely we have our place. There's no question that we have our place. We do have general pathologists or pathologists who have specialized, decided to focus on head and neck, who are par excellence and are really great. We have people like here, we have someone like Dr. Anita Borges. No one can ever question her authority on oral and maxillofacial lesions. But but then those are people again who have taken the time to actually study oral and maxillofacial. So in a way, they have also super specialized. But I think if you take an average, an oral pathologist and just a general pathologist, and you compare on the basics of what they would be their diagnosis like, definitely in an oral and maxillofacial lesion, the oral and maxillofacial pathologist would do better on an average if you just take the basic level. There is no question about that. But the point is that sometimes we need to believe it. And I have always said it is very interesting, especially when we have whenever we have a discussion, we have self-doubt is more than what others doubt us.
Yes. Yes.
Because and we have seen this in our case presentation conference. I don't know if you have noticed, but every time there is a question on a diagnosis, okay, inevitably the person who is talking will tell you that we have double checked it with a general pathologist. And I have no issue with double checking with a general pathologist who is an authority on that topic. But if you just think that any average general pathologist does not necessarily become an authority to, that just because a general pathologist has said it is this is not, I don't think it's logical. But we do that, and every time we come across it, and I'm sure every time any of you have listened to a case discussion, you have come across it. So this is our own internal problem. This we need to sort out from within. It is not an external problem. It's not that others don't trust us. It's a question of how much we trust ourselves. We have some comments on YouTube. Before we wrap up, let's just go through them. Of course, we already answered some of it. So there's only one, that is oncopathology after MDS in oral pathology in India. Well, I think oncopathology is
Yes,
accessible to
It's
anybody.
there,
Yeah.
ma'am.
Yeah.
Two hospitals I know. One is Dharamshila Narayana Hospital. It offers fellowship specifically to MDS oral pathology students. And then we have Malabar Cancer Center, Trishari in Kerala. They also have fellowship in head and neck pathology. And that's why I have written, POPMA has written to other cancer centers to open more um, uh, offerings to MDS oral pathology specifically. Because if you want to go and join and do observership, nobody will stop you. But having an official fellowship where you get the stipend, for that I am
Yes.
more worried. Because then you are being discriminated between a general pathologist and a oral pathologist.
Yes.
So two I know,
Very
and
true.
there are many institutions which are offering head and neck onco surgery to MDS oral and maxillofacial surgeons. So, but for oral pathology, there are very few. So two
Very
I
few.
know and have told.
Yes, that's true. So we are almost at the hour mark. So let me ask everyone, put on your cameras. Okay, so Vivek, yes, you can ask your question yourself.
My question is to Mohan sir. Sir, please tell
Yes.
us about the oral pathology magazines that you were mentioning, sir.
Yeah, the oral pathology magazine under POPMA is the oral pathologist. That is the name of the magazine. And already 9 members are there for the POPMA magazine committee. And 2 are the editors, Dr. Aparna and Dr. Rujuta. They are taking care of that. And by the month of October, it will be released, and we'll definitely share with you the soft copy. And that's it. And under that, we will be highlighting the work which POPMA has done. Then we will highlight some of the cases and some part from the art of pathology and the achievements of POPMA members, and what is the current or the newer technique or new uh, events on or new technology which is being there in the field of pathology and oral pathology. So that all will be shared in that magazine.
Yes.
I hope you wanted that information, or anything else is there.
Sir, kindly please tell about the observership and fellowship also, sir, that providing, sir.
Okay. See, for observership, you have to be, for both the things, you have to be a member of POPMA. And then we initially only, because the POPMA was registered in September of 2023, and by October we have designed the curriculum for the fellowship and observership, and there is some amount of payment for that, and then you can join that observership and fellowship. Fellowship is for 6 months, and observership is for 15 days. And all the details are available on the website of POPMA, that is popma.in. So when you Google it, you will get all the information, what all eligibility criteria. And I have made specifically only for MDS oral pathology, because everywhere you see MD pathology. That's why I have created one specifically for uh, oral pathologists. And it's a skill-based training program. It is not at all recognized or accredited by any statutory body like DCI, MCI, NMC, or UGC. So that is the thing. It's only to hone up your skills.
Thank you, sir.
Right. So I'm going to ask everyone, put on your cameras. Let us just have a look at everybody. Let everyone meet before we say bye. Hi, Madhavi.
Hello, ma'am. Good evening.
Good evening. Yes, you
I
want to ask
joined
something
late.
question? Sorry.
Yes, ma'am. Sir mentioned regarding the fellowship of oncopathology. I wanted little more details on that. Like, is it a full time or two colleges you
No, no, it
mentioned? Could you?
is. I'll tell you, ma'am. Two colleges are there. One is Dharamshila Narayana Hospital, New Delhi, or Dharamshila
Oh,
Narayana Cancer Center. You get.
yes,
I'll share with you personally all
yes,
the
sir.
details. You can note down my number. That
Oh,
is 70-270-38190.
sir, one. So, can you please
I will
narrate?
share it
70.
with you, Madhavi.
Yes, sir. Yes, ma'am. Yes,
Okay.
sure.
And
Okay,
it's a
that will be
full-time
easier.
course.
Okay,
Full-time course, 1 year course is there. For that,
okay,
there is no defined curriculum. But at Malabar Cancer Center, Trishari,
okay,
Kerala, they have completely designed curriculum for that, and you have to pass the exam after one
okay,
year of the fellowship.
okay,
That is, and it is the eligibility criteria is MDS oral pathology and microbiology.
okay, sir.
Yes.
ठीक है, sir.
I'll share with
Anything
you
else?
my number.
Yes, sir. Thank you,
Hmm.
sir. Thank you.
Most welcome.
So anyone else would like to put on your camera so we can see you? Hi, Anupama.
A very good evening to everyone.
Yeah. Hi,
I'm
Dr.
glad that
Anupama.
everyone is.
Yes. So we are at the end of the program. It is 6:04, so we finished the hour. Anyone wants to say anything before we close? You can add in a comment if you would like, and then we say bye.
Thank you for it. It was very, very interesting.
Thank you for staying with us. I know the topics
And
might not have been that interesting to you, but you're kind
It
enough to
was.
stay.
It was.
Thank
now,
you.
Opma and Oral Pathology 360 are official associates, ma'am. I think you
Yes. Oh,
should
yeah.
only announce
I
that.
forgot. Yes, actually, since the announcement has gone out, actually, but all of you might have noticed through all our channels of the email and everywhere else, is that now Popma is a association partner of, or rather a member of the Oral Pathology 360. So the same way we have members on YouTube, we have channel members. Now Popma also is a organizational member. What that means is that we will be doing some programs together. And also when Popma has any programs, we will be sharing it on our calendar of events so that you can find their events very easily. And we basically will be doing more together.
Yes.
And the final aim is the same, is to promote oral pathology, to promote the diagnostic sciences, and of course to eventually help patients get the best expert care that they can get anywhere in the world. So yes, we are now doing more together, and that's about it. Right. Okay. So shall we say bye?
Yes.
Okay. Right.
Thank you.
Thank you so much. Thank you, everybody, for being with us. And this was our celebration. So thank you again. And thank you for your support always, not just today, all the time. Thank you.
Thank you
See you
so
all.
much,
Thank
ma'am,
you.
for giving
Thank
the
you.
opportunity.
You're welcome. My pleasure. Thank you. Bye.
Bye.
Bye.